What if I told you that something you have probably been doing since your teenage years could be secretly undermining your heart health, weakening your prostate, and draining your emotional well-being after 60? Most men have never been told the real connection between masturbation and the cascade of changes happening in their bodies as they age. Today, I am going to reveal the scientific truth about how this private habit affects 3 critical areas of your health, and why understanding this could be the key to reclaiming your vitality. My name is Dr. Eva Hart, and I am a certified urologist with 14 years of experience helping men over 60 navigate the complex changes in their bodies and minds. I have seen thousands of patients struggle with questions they are too embarrassed to ask, carrying shame about topics that should be discussed openly with medical professionals. This is a conversation most men avoid, even with their doctors. Society has made this topic so taboo that we suffer in silence rather than seek the answers we desperately need. But silence does not protect you. It leaves you vulnerable to misconceptions and missed opportunities for better health. Your body deserves honest, scientific information, not myths or judgment. In this video, I will walk you through the real scientific evidence about how masturbation impacts your cardiovascular system, your prostate health, and your mood regulation as you age. We will explore what research actually shows, not what popular culture assumes. This is about more than just physical function. It is about understanding your body, making informed choices, and taking control of your health with knowledge rather than fear. You have the right to feel confident in your decisions about your own body. Stay with me until the end because I will share something that most doctors never discuss with their patients, a simple understanding that could completely change how you approach this aspect of your health and well-being. And if this topic resonates with you, share in the comments what exactly speaks to you. And if it does not, let me know how I can improve the content and what topic would be more interesting for you. But first, let me tell you about something I have observed that might surprise you. The men who come to my office with the most confusion about this topic are often the ones who have been making decisions based on outdated information from decades ago. What we know now about the male body after 60 is dramatically different from what was believed even 10 years ago. Let me tell you about something that quietly affects millions of men over 60, yet rarely gets discussed in medical offices. The relationship between masturbation and heart health is far more complex than most people realize, and what I have learned through years of treating older men might challenge everything you think you know. Here is what actually happens in your cardiovascular system. When you engage in any form of sexual activity, including masturbation, your heart rate increases, your blood pressure rises temporarily, and your entire circulatory system responds. For younger men, this is typically a mild, beneficial form of exercise. But after 60, your cardiovascular system is operating under different conditions. I have noticed something concerning in my practice over the years. Men come to me worried about chest discomfort, irregular heartbeats, or unusual fatigue, and when we dig deeper into their lifestyle, patterns emerge. The cardiovascular demands of sexual activity, including masturbation, can sometimes reveal underlying heart conditions that were previously undetected. But here is what most doctors will not tell you. Moderate sexual activity, including masturbation, can actually benefit your heart health when approached mindfully. Research published in the American Journal of Cardiology shows that regular sexual activity may reduce the risk of heart disease in older men. The key word here is moderate. The real concern is not the activity itself, but how it interacts with existing cardiovascular conditions, medications, or stress levels. If you are taking blood pressure medications, have irregular heart rhythms, or experience chest pain, the sudden cardiovascular demands can become problematic. What I recommend to my patients is simple awareness. Pay attention to how your body responds. If you experience chest pain, unusual shortness of breath, or heart palpitations during or after sexual activity, this is your body giving you important information about your cardiovascular health. Your heart muscle, like any other muscle in your body, needs appropriate exercise to stay strong. Sexual activity provides a form of interval training, brief periods of increased cardiovascular demand followed by recovery. This can actually help maintain heart health when done within reasonable limits. However, if you have been sedentary for months or years, suddenly engaging in intense activity can strain a deconditioned heart. The solution is not to avoid activity entirely, but to approach it gradually and listen to your body's signals. Think of sexual activity as you would any other physical exercise. It should energize you, not exhaust or frighten you. The bottom line is this: your heart health and your sexual health are connected, but not in the way most men fear. Understanding this connection empowers you to make better choices for your overall well-being. But what about the organ that every man over 60 worries about most? The connection between masturbation and prostate health might be even more important than the cardiovascular effects, and what I am about to share could change how you think about protecting this vital gland. I have spent countless hours with men who are terrified about their prostate health, and much of this fear comes from misinformation about masturbation. Let me give you the scientific truth that can help you make informed decisions about your health. Here is what most men do not understand about the prostate after 60. This walnut-sized gland has been working non-stop for decades, producing the fluid that makes up about 30% of your semen. As you age, the prostate naturally changes. It often enlarges, its function shifts, and its needs evolve. The relationship between masturbation and prostate health is one of the most misunderstood aspects of male health. Some men believe that frequent ejaculation will wear out their prostate, while others worry that abstaining will cause problems. Both of these fears are based on misconceptions. Research from Harvard Medical School followed over 29,000 men for 8 years and found something remarkable. Men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times per month. This included all forms of ejaculation, partnered sex, masturbation, and nocturnal emissions. But here is the nuance that matters for men over 60. The benefit is not necessarily about frequency alone. It is about maintaining healthy prostate function through regular, gentle activity. Think of it like exercise for your prostate. Just as your muscles need movement to stay healthy, your prostate benefits from regular function. However, I have also seen men who become anxious about meeting some specific number, turning a natural function into a source of stress. This completely defeats the purpose. The goal is not to achieve some magic frequency, but to listen to your body and maintain what feels natural and comfortable for you. What matters most is quality over quantity. Gentle, relaxed activity that does not cause physical or emotional stress is far more beneficial than forced or anxious behavior. Your prostate, like the rest of your body, responds better to kindness than pressure. Prostate also benefits from the improved blood flow that accompanies sexual activity. Enhanced circulation helps deliver nutrients and oxygen to prostate tissue while removing waste products more efficiently. This increased blood flow can help reduce inflammation and support overall gland health. Additionally, regular ejaculation helps flush out potentially harmful bacteria and old cellular material that might otherwise accumulate in the prostate ducts. Think of it as a natural cleansing process that your body is designed to perform. When men completely stop ejaculating, whether through partnered activity or masturbation, this natural cleansing mechanism becomes less active, potentially allowing harmful substances to build up over time. If you are reading this and it resonates with you, type a +sign in the comments. It is important for me to know that this information is helping you understand your body better. Now, there is one more piece of this puzzle that might be the most important of all. Connection between masturbation and your emotional well-being after 60 involves brain chemistry that most men have never learned about, and understanding this could be the key to better mood, energy, and overall life satisfaction. What I am about to share with you might be the most important part of our conversation today. The relationship between masturbation and mood in men over 60 involves complex brain chemistry that can significantly impact your daily quality of life. Here is something troubling that I have observed in my practice. Men come to me feeling depressed, anxious, or emotionally flat, and they rarely connect these feelings to their sexual health or habits. Yet the connection is profound and scientifically documented. During sexual activity, including masturbation, your brain releases a cascade of chemicals: dopamine, oxytocin, endorphins, and prolactin. These are not just feel-good chemicals, they are essential regulators of mood, sleep, stress response, and emotional well-being. After 60, your brain produces these chemicals less efficiently than it did in your younger years. This means that the natural mood benefits of sexual activity become even more important as you age. Regular, healthy sexual activity, whether partnered or solo, can help maintain the brain chemistry that keeps you feeling emotionally balanced and mentally sharp. But here is where many men over 60 get stuck. They feel guilty or ashamed about masturbation, which creates stress and anxiety that completely cancels out the potential mood benefits. The shame becomes more harmful than the activity could ever be helpful. I have worked with men who stopped all sexual activity because they believed it was undignified at their age, only to experience increased depression, sleep problems, and irritability. When they understood the science and gave themselves permission to maintain their sexual health without judgment, their overall well-being improved dramatically. The research is clear. Men who maintain some form of sexual activity throughout their lives report better mood, less anxiety, and improved sleep quality compared to men who become completely sexually inactive. This includes masturbation as a valid and healthy option. What matters is your relationship with the activity. If it brings you pleasure, relaxation, and stress relief without causing guilt or compulsive behavior, it is likely benefiting your mental health. If it creates shame, anxiety, or becomes compulsive, then it may be working against your well-being. These brain chemicals work together in fascinating ways. Dopamine provides motivation and pleasure, while oxytocin creates feelings of connection and bonding, even when you are alone. Endorphins act as natural pain relievers and mood elevators, similar to what you might experience after good exercise. Prolactin promotes relaxation and sleepiness, which is why many men feel drowsy after orgasm. As you age, your baseline levels of these chemicals naturally decline, making the temporary boost from sexual activity increasingly valuable for maintaining emotional equilibrium. Some of my patients have discovered that maintaining regular sexual activity helps them sleep better, worry less, and approach daily challenges with greater resilience and optimism. The goal is balance and self-compassion. Your sexual health is part of your overall health, and you deserve to approach it with the same wisdom and care you would give to any other aspect of your well-being. This understanding leads us to something even more important: how to use this knowledge to actually improve your life starting today. What I am about to share ties together everything we have discussed and gives you a practical path forward. Here is what countless men tell me after we have these conversations. They wish someone had explained this years ago. The integration of sexual health into overall well-being does not have to be complicated, but it does require honest self-awareness and a willingness to let go of outdated shame. I have noticed something powerful among my patients who embrace this approach. When men stop fighting their natural sexual needs and instead learn to integrate them healthily into their lives, they often experience improvements in areas they never expected: better sleep, less irritability, improved relationships, and even better physical energy. Key is what I call mindful integration. This means approaching masturbation with the same thoughtfulness you would bring to any other aspect of your health routine. Pay attention to how it affects your mood, your energy levels, and your overall well-being. Some of my patients find that morning activity helps them start the day feeling more relaxed and positive. Others discover that evening activity improves their sleep quality. There is no universal right answer, only what works for your body and your life. But here is the crucial part: release the numbers game. Whether it is once a week or several times a week, what matters is that it feels natural, beneficial, and free from compulsion or guilt. Your body will guide you if you listen without judgment. Consider this activity as part of your overall self-care routine, alongside exercise, good nutrition, and adequate sleep. It is not separate from your health, it is part of it. When you approach it this way, it becomes a source of well-being rather than confusion or shame. Most importantly, remember that your sexual health evolves as you age, and that is completely normal. What felt right at 30 or 40 may be different now, and that is not a loss, it is adaptation. Your body is wise enough to guide you if you create space to listen. Creating the right environment and mindset makes a significant difference in how this activity affects your well-being. Choose times when you feel relaxed and unhurried, rather than treating it as something to rush through or squeeze into a busy schedule. Pay attention to your stress levels, physical comfort, and emotional state beforehand. Some men find that taking a warm shower first helps them relax, while others prefer gentle stretching or deep breathing. The goal is to approach this as a form of self-care rather than a mechanical release. This mindful approach not only enhances the immediate benefits but also helps you maintain a healthy, shame-free relationship with your sexuality as you continue to age. If you are dealing with any concerns about how this affects your heart, prostate, or mood, do not hesitate to discuss this with your healthcare provider. These conversations should be as normal as discussing your blood pressure or cholesterol levels. But there is one final piece that brings everything together, understanding that this is ultimately about much more than physical function. It is about maintaining your connection to vitality, pleasure, and self-acceptance as you age. What I want you to understand most deeply is this: your sexuality does not have an expiration date. The shame and confusion surrounding masturbation after 60 often reflects broader cultural messages that older men should somehow become asexual beings. This is not only untrue, it is harmful to your overall well-being. Throughout my years of practice, I have seen how powerfully liberating it can be when men give themselves permission to maintain their sexual health without apology. This is not about being inappropriate or ignoring your age. It is about honoring the full spectrum of human experience that includes physical pleasure, emotional connection, and personal satisfaction. The men in my practice who age most successfully are those who maintain curiosity about their bodies, compassion for their changing needs, and courage to adapt rather than simply give up. They understand that sexual health is inseparable from mental health, physical health, and overall life satisfaction. Here is what I want you to remember: you have the right to feel good in your body. You have the right to experience pleasure without shame. You have the right to make informed decisions about your sexual health based on science rather than fear or outdated cultural messages. The research we have discussed today about heart health, prostate protection, and mood regulation gives you a foundation for making those informed decisions. But ultimately, the most important research is paying attention to your own body and your own experience. Your sexual health after 60 can be a source of vitality, self-knowledge, and even joy. It does not have to be a source of confusion, shame, or fear. With the right information and a compassionate approach to yourself, you can navigate this aspect of aging with confidence and wisdom. Remember, every choice you make about your body should come from a place of self-care rather than self-punishment. Whether you choose to maintain regular sexual activity or decide it is no longer right for you, make that choice from knowledge and self-compassion, not from shame or fear. Society often portrays aging as a process of gradual loss and withdrawal from life's pleasures, but this narrative is both false and damaging. Your capacity for pleasure, intimacy, and sexual satisfaction can continue throughout your life, evolving and adapting as you do. Some of my patients report that their later years have brought a deeper understanding of their bodies, a freedom from performance pressure, and a more authentic connection to their desires. This wisdom that comes with age can actually enhance your sexual experiences rather than diminish them. Key is rejecting the myth that sexual pleasure is only for the young and embracing the truth that it belongs to you at every stage of life. Your body has carried you through decades of life, and it deserves your respect, understanding, and kindness as it continues to change and adapt. The truth about masturbation and your health after 60 is simpler than you might think. It can be a healthy part of your life when approached with awareness, moderation, and self-acceptance. Your heart, your prostate, and your emotional well-being can all benefit when you release shame and embrace informed choices. You have the power to age with vitality, pleasure, and confidence, and that includes your sexual health. Retriclod can make mistakes. Please double-check responses.